Hi guys, my name is Kelly and today I'm going to be doing the central line scale. So the first thing I want to do is check my physician orders, make sure that everything's good and that I'm going into the right patient's room. So this is for Miss Wanda Chi, date of birth 9/20/19XX. She has no allergies. These are my 8 o'clock orders, and the physician says maintain central line placement, central line sterile dressing change every 7 days or PRN. Every 7 days and PRN, sorry. Notify MD for any signs of infection, redness, tenderness, swelling, purulent or foul smelling drainage. So I've checked my orders, everything looks good. So now it's time to gather my equipment. So I have my central line dressing kit, my bio patch, my ruler, and some gloves. And so nothing has expired, nothing has been opened, and I'm ready to go into my patient's room. So knock knock. Hi Miss Chi, my name is Kelly. I'm going to be your nurse today. I'm going to be changing your central line dressing, okay? We want to keep it clean and intact. And she says okay. I ask her for her name and date of birth. She says Miss Wanda Chi, 9/20/19XX. Okay, Miss Chi, do you have any allergies? No allergies. Okay, awesome. So I ask her if she has any questions about the procedure. She says no. And so again, I've explained to her that it's to prevent any risk for infections or prevent any infections, just to keep it clean, and we have to do this every 7 days or as needed. And so she's ready, I'm ready. So I have provided privacy. I have raised her raised her bed, lower her rails, and put her in a comfortable position so that I can do this. Everything is in reach and everything is good to go. So I want to do some hand hygiene and put on my gloves. And I want to just assess it first before I take anything off or anything. So I want to assess the site, make sure that there's no redness, no swelling, no tenderness, no smelling, no drainage, nothing like that. It's clean and it looks good. So at this point I want to measure with my ruler, and so I'm going to be measuring from the insertion site all the way down to the tip. And I want to do this because I want to make sure that it hasn't came out of placement or anything like that. So once I get my measurement, I'm going to want to compare that to what's measured or to what's in the chart, just to make sure that everything matches and everything is still good. So I've done that, and so now I want to start my cleaning. And so I have my bio patch here and I have my kit here, and I want to open this really carefully. Keeping in mind that all this is sterile, right? Because I don't want to. There it goes. Okay. Okay. So the first thing in here is my mask. So I want to go ahead and apply that. Oops. And I want to do this so that I can prevent any droppings of when I'm talking to go into the patient. So I've applied my mask. And at this point I want to ask my patient to go ahead and turn over, just so that she doesn't talk through the procedure, or I would apply a mask on her. I want to also now take the Tegaderm off, right? Because I have my gloves on here. And so at this point I just want to take the Tegaderm off really carefully, making sure that I don't move anything out of place. And the little bio patch is going to come off with it. And so I am going to want to dispose of my gloves at this point. So that's going to be trash. So at this point, I want to take out my sterile gloves. So here they are. And I'll place that there. And then I want to go ahead and drop my Tegaderm in there. So, not my Tegaderm, my BioPatch. So I want to drop my BioPatch in there. And so everything is in there. I'm just going to move this aside so that I can apply my gloves on at this point. Okay, so I dropped my little BioPatch, and now I want to apply my sterile gloves. Okay. So I'm going to go ahead and apply these. Let me lift this up a little bit. Okay. And then these are clean, so so my gloves are on, so at this point I'm just going to throw that away. So my gloves are on, and one glove is going to be my dirty, which is I'm going to be grabbing the little central line from, and then my clean hand is going to be grabbing out of there. So I've applied my gloves, and now it's time to clean with my chlorhexidine here. And I would activate this, and then I would clean. So I would back and forth clean for about 30 seconds. And I would again back and forth clean, because this is going to cause friction and it's going to clean off all the nastiness off of there. I'm going to clean down here where my Tegaderm is going to be placed, and again this is going to be going on for about 30 seconds, back and forth, and then I would throw that out, and I would allow for this to dry for another 30 seconds before I place my BioPatch. So it has dried, and I come here from my little BioPatch and blue side up, and I'm just going to make sure I put that on there correctly like that, and I'm going to go ahead and drop this and apply my Tegaderm. So I'm going to come in here and grab my Tegaderm here, and then I'm going to apply it. I want to make sure that I apply it where my BioPatch is right in the center. So I put that on there, and everything's good. And then I'm going to want to date, time, and initial it on this little paper here. So I date, time, and initial it. And then all this is done because my sterile technique is over. And I want to date, time, and initial, like I said, and I want to place this somewhere where it's visible but not covering my insertion site. So I'm going to put it there, and that's good. And I'm done, and everything is clean, and everything was kept sterile. And so at this point, I would clean up all my mess, and I would put my bed back in low position, raise my rails up, put the cowbell in reach, perform hand hygiene, and I would document that I did sterile technique and that my patient tolerated well, and that's it. Thank you guys.